Okay, the next body system that we're going to talk about is the hematologic system. So, red blood cells, so we're talking about the infant, of course, red blood cells, because fetal circulation is less efficient at oxygen exchange in the lungs. The fetus needs additional red blood cells for transport of oxygen in utero. So, normal oxygen levels in utero are much lower than oxygen levels that we experience. So they need more red blood cells in utero to be able to efficiently exchange oxygen. So these levels are higher in a newborn than in an adult at birth. Normal hemoglobin is 14 to 24, and hematocrit 51 to 56. The capillary sample is higher than the venous values, and the time of the sample is also significant. So it's important to note with pretty much all the tests and lab work that you do on infants, that the time, how old the baby is, the time of the sample is significant. So what was normal at 3 hours is going to be different than 6 hours, including when we get to talking about bilirubin and the age, but just know that time is significant. Leukocytes, the normal is 18,000. The normal range, so the average is 18,000, but the normal range is 9 to 30,000 at birth. It increases to 23 to 24,000 at day 1 and then rapidly decreases. So they're born at approximately 18,000 with a WBC count of 18,000 at birth. On day 1, it rises to 22 to 24,000 and then rapidly decreases. For newborns, their leukocytes are slow to recognize infection, and they can be septic or very sick without a significant increase in their WBC cells because their white blood cells and immune system are not mature enough to recognize infection as quickly as in children and adults. Platelets, the normal platelet level is 150,000 to 300,000, which is the same as adults. And we administer vitamin K after delivery to increase clotting factors. For the blood groups, the blood type can be determined early in life. Cord blood samples can be used to determine the blood type and Rh status. And this is important to know whether you should administer Rogaine to the mother. So this slide talks about the formation and excretion of bilirubin. So kind of starting out at the top, and this is on page 532 in your book, and this notes the breakdown of red blood cells into the hemoglobin is broken down into heme and globin. The heme is further broken down into iron and bilirubin, and then the liver has to change the bilirubin from unconjugated, which is fat soluble, to conjugated, which is water soluble, so the bilirubin can be ultimately excreted through the feces and urine. So the conjugation process takes place in the liver, and it's from unconjugated bilirubin, which is fat soluble, to water soluble conjugated bilirubin for excretion. The thermogenic system, so thermoregulation is the maintenance of balance between heat loss and heat production, so trying to stay normothermal. Infants lose heat by 4 different ways: convection, radiation, evaporation, and conduction. So next to establishing respiration and adequate circulation, heat regulation is most critical for newborn survival. Newborns have a thin layer of subcu fat. Their blood vessels are close to the skin, and they have a large surface-to-body weight ratios, and these make it harder for infants to maintain their temperature. So the 4 different ways that infants can lose through heat. First is convection, and this is the loss of body heat to cooler ambient air. So what you can do is increase the room temperature, especially at delivery, whether it's a vaginal delivery or in the OR. Swaddle the infant, dry them off very quickly, and put a cap on their head. So convection, loss of body heat to cooler ambient air. With the room temperature increase, swaddle and put a cap on their head. Next is radiation, and this is the loss of body heat to indirect cooler surfaces. So it's important to keep the crib away from outside windows and any kind of drafts, whether that's basically, opening, closing doors, and cribs, keep them away in the NICU or in the mother's room, keep them away from outside windows. Evaporation is the third way, and this is loss of heat from liquid to vapor, and you dry the infant quickly after birth, and infants lose heat most significantly through this form of heat loss of evaporation. And fourth is conduction, and this is loss of heat to direct cooler surfaces. So this is why you'll see nursery nurses pre-warming the infant warmer, so you turn it on and get the surface warm before delivery, and covering scales with a blanket or a chucks that's disposable, so you're not placing a new infant on a cold scale. You're putting something between them. Thermogenesis is how infants produce heat. They increase their muscle activity, and they maintain their position of flexion. So this is how newborns produce heat, by increasing muscle activity, and their norm is to maintain a position of flexion where their knees and arms are to the body core. Non-shivering thermogenesis is where infants metabolize brown fat and increase metabolic activity in their brain, heart, and liver. So infants cannot shiver, so how they produce heat is to metabolize their brown fat. Infants have brown fat, adults do not have brown fat, so this is only found in infants, and preterm babies don't have as much brown fat to metabolize as term babies do. Cold stress depletes brown fat quickly, so you want to do all you can to decrease heat loss by convection, radiation, evaporation, and conduction. You don't want a baby to have to be stressed because of cold. Then they start burning their brown fat very quickly, and they don't have as much reserves. So when infants experience cold stress, vasoconstriction occurs to conserve the heat. Infants will appear pale and mottled, and their extremities are cool to the touch. Their respiratory rate increases, so they can have a transient respiratory distress. They can also have metabolic acidosis, hyperbilirubinemia, and hypoglycemia. So, believe it or not, people tend to forget about keeping babies warm, especially when they are born sick and they have something wrong with them. We're really focused on the respiratory or ABCs, but we tend to forget about letting them get cold. And actually, babies can ultimately die from cold stress. So if a baby's sick, one of the first things you want to do is check their temperature and make sure they're not cold. Opposite of that is hyperthermia, which is a temp greater than 99.5. This occurs way less frequently than hypothermia. You usually always have to be worried about hypothermia and not hyperthermia in newborns. It's caused by excess heat production, sepsis or decrease in heat loss, inappropriate use of external heat sources such as warmers, room temperature, and excessive clothing. So it can be caused by sepsis or just basically us overheating the baby. The signs and symptoms of hyperthermia are dependent on what's causing it. So if it's being caused because of inappropriate use of external heat, basically we've overheated the baby's going to do heat-losing mechanisms such as extension of their body. You know, instead of flexion, they're going to extend their body to rid themselves of some of that heat. If they have hyperthermia related to sepsis, the babies are extremely stressed and they look very sick. They have constricted vessels, they are pale, and their hands and feet are cool. Hyperthermia can result in neurologic damage and seizures. Next, we're going to talk about the renal system. After day of life 4, infants should have 6 to 8 voids of straw-colored urine, and that indicates that they have adequate intake. Pink-tinged uric crystal stains are normal for up to 1 week, and it indicates inadequate intake. So it's normal for parents to be changing a diaper, and there's this pink-tinged uric acid stain on the diaper, and they get very concerned about it. That's normal for a week. If that occurs greater than a week, then we know the baby's not getting adequate intake to help get rid of those uric crystals. The loss of fluid and limited intake results in a 5 to 10% weight loss in the first 3 to 5 days of life. And so that's why babies are weighed daily, because the loss of fluid and limited intake, especially if they're breastfeeding, it's normal for babies to lose up to 5 to 10% of their total birth weight in the first 3 to 5 days of life. They should regain to birth weight by 10 to 14 days. So basically what we say is by 2 weeks of life, infants should gain back to their birth weight. Daily fluid requirements are 60 to 80 milliliters per kilogram for 2 days. It increases to 100 to 150 milligrams per kilogram for day 3 to 7, and then 120 to 180 milligrams per kilogram per day for the next 8 to 30 days. So it's, you have to be careful and really teach caregivers not to overfeed an infant, that their stomachs are actually very small when they're born. An infant should void within 24 hours of life, and 98% of infants void within 30 hours of life. So usually if they haven't voided within 24 hours of life, that's something you want to probably notify the caregiver about, the provider. If an infant hasn't voided within 48 hours of life, it may indicate a renal impairment. Some of the signs of renal problems include that they can range from a lack of steady stream, the urinary stream, to a visible anomaly. So the first symptom could just be that they don't have a steady urine stream, or babies are born with just congenital anomalies that you can recognize. They can have a palpable mass in their abdomen, and a lot of times renal issues can be identified on a prenatal ultrasound.